gotta shock him. Clear!
We're losing him. He's gonna die.
Nobody dies. Not on my watch.
Stop! 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 What are you people doing?
We're shooting a TV show.
TV show? This is a training video.
Training video?
What are you supposed to be?
I'm a zombie.
There are no zombies. This is education.
What if I have a disease? Well, oh, no. What if I was exposed to some hazardous material?
Who are you?
I'm here for the calendar shoot.
This is not a TV show. This is not a zombie movie, and this is not a firefighter calendar shoot. This is a training video!
I'm Captain Barrett Baker with the Tucson Fire Department. In this profession, we're exposed to infectious diseases on a daily basis. And in order to keep ourselves, our families, and our communities safe, it's time to get back to basics. Today, we're putting together a training video with Tucson and Pima County departments and districts to talk about the basics of personal protective equipment. How to put it on safely, how to take it off safely, and just as importantly, what is the proper level. To start off today, we're going to discuss our Tier 1 level of personal protective equipment. But what does that mean? Well, this is the level that we're going to be using the majority of the time we get dispatched to that person that is just sick in nature, but we don't have any secondary indications. So Captain Valenzuela is going to demonstrate what we're going to do when it comes to protecting our eyes, our nose, our mouth, and our hands. To start off with, let's protect the eyes. Making sure that you wear a proper size eyeglass, safety eyeglasses, that when he's working, they're not going to be falling off, but they're tight enough and large enough that they're actually protecting the eyes themselves. Second step is the N95. Now this is the standard of care that's going to protect you from an infectious disease. He's going to show you how to put it on, but if you don't know how to do it, there also are directions on the packaging. Again, we want to make sure that we're protecting our nose, our mouth, our eyes, anything from any type of infectious disease, material, vomit, emesis, from getting into those types of avenues for us. On this particular thing, there's a squeeze on the nose. You want to make sure it goes under the chin. There's 2 straps around the head to make sure that it stays nice and tight. Last thing we need to do is protect the hands. We're going to be touching the patient constantly throughout that. We want to make sure that those are protected. As you can see, he's sliding those on, and in this particular case, they fit appropriately. You have so many different sizes of gloves between small to triple XL, but you have to make sure that you find those that are right for you. So again, that Tier 1 level of protection is glasses, N95, and gloves, and that's what we're wearing 100% of the time. Now, Captain Valenzuela is in his Tier 1 level of personal protective equipment. But there's certainly one thing we know about emergency services in the fire department is things change. When you get on scene and now you have a secondary indication that something might be a little more severe with that patient, it's time to go to Tier 2. The important thing about Tier 2 is to have it ready though. It's better to have it and not need it than need it and not have it. So Captain Valenzuela has made up a kit of the personal protective equipment that's going to give him more barriers in between himself and perhaps somebody that is sick. Donning that tier 2 level of personal protective equipment might take a little bit of time, so it's important that we've practiced beforehand and you understand how to do it appropriately. First step with our tier 2 is covering your feet. Now, anytime we go somewhere in someone's house, there's the potential to take things from one room and take them into another, taking them from that house back to the ambulance, from the ambulance to the hospital. But we want to minimize our exposure to our work boots and our uniforms. Again, practice makes perfect, and by doing something like this beforehand, making sure that you're familiar with putting them on. Obviously, you can see that these have an elastic band at the top as well, so they're going to snug up. He's going to tie around the ankle. Obviously, we don't want to be tripping in someone's house, so by not having those things laying on the ground, you're going to protect yourself as well. Again, tier 2, something has changed when we got on scene. If the patient has now vomited, if we're having some sort of bodily fluid that we think is going to be potentially harmful for us, it's time to escalate and go into this next level. After we've taken care of our feet, next step is going to be the gown. Now, these things are not rocket science, but they can make us look a little bit like we've never done it before, if we've never done it before. So, practice, practice, practice. In this particular case, we have a secondary barrier between our uniform and being on scene in that person's house. We have to assume sometimes that people have things that are bad for us, and by making those assumptions, we do a better job of protecting ourselves. This particular gown, he's going to tie it around the back, and as we'll see when he brings his hands back out to the front, you have an actual thumblet where your initial set of gloves has gone through the thumb. You have a sleeve here for all intents and purposes, but we're going to double glove it now. We've already taken care of our tier 1. We already have the eyes protected. We've protected our mouth and our nose. We had our initial set of gloves on. We're now putting the barrier between ourselves when protecting our body. We've got the boots on, a secondary set of gloves. Again, with the gloves, now we basically have 2 gloves. These are going to fit a little more snugly because we have 2 layers on underneath. Important thing when it comes to the double set of gloves is to make sure that they're over the sleeves. The last thing that we have, it's never a bad thing to have too much protection. If you feel like you want another level of protection based off what type of gown you have, then you always have the availability to wear a second set of sleeves as well. So, tier 2, things have gotten a little more serious. It's time that we escalate, protect ourselves, take that next step. Now, climbing Mount Everest is quite a feat, but not so much if you don't get down safely. And the same premise applies to tier 2 level of personal protective equipment. If you put it on safely, but do not take it off safely, then you're jeopardizing your health, your family's health, and the community's health. So Captain Valenzuela is now going to show us how to doff the PPE, but it all starts beforehand. Make sure that you have an EPA-registered disinfectant wipes and also something to put the jeopardized equipment in afterwards. We're going to start with the wipe, and Captain Valenzuela is going to take care of any gross contamination on his hands. Your hands are the things that have probably handled the patient the most and the equipment the most, so it's very important that you're thorough. If you need to take 2, then you're going to take 2. Now we've thoroughly disinfected those first set of gloves. He's going to now pull the gloves off. Notice the technique that he's doing. He's taking one glove off, he's putting it in the other hand, now reaching inside the sleeve of the glove and trying to overwrap the contaminated material of the glove. We're disinfecting that, we're putting that away. Now, gross decontamination. If you feel like you want to take another wipe, then do so. These should be plentiful. Second set, we're going to take the gown off itself. Now this should be a tearaway gown, and he's going to do the Hulk Hogan impersonation. Again, making sure that anything that is on the outside is going to try to stay on the outside, and we're trying to contain that, wrap it up in something. If it's falling out, obviously it's important to leave it over the bag as much as possible. Now, third set, we're going to take the boots off. Anything that was in that house is on those boots. We don't want to take that out of the household itself. Notice, the constant that we see with any part of the doffing is trying to maintain the bad stuff and keeping it on the inside of whatever level of equipment you're taking off. Wrapping it over, trying to make sure that you're not touching that. But this will go to show why it's so important that we wear 2 sets of gloves. Now, we're basically down to our Tier 1 level of protection at this point. We still have our glasses, our mask, and our gloves. So Captain Valenzuela, now removing the glasses. Those are contaminated, we're putting them in, taking the mask off. Try not to touch any part of your skin, and he did a great job of going out and over. The last thing that we have, the last set of gloves. Again, touch one glove, wrap it up, put it inside the other glove, you have a clean hand. Go inside the glove, take over, wrap out, and most importantly, the final act of disinfecting anything and everything to give you that sense of protection and safety. Getting up the mountain is important. Getting down the mountain is most important. Same thing. Donning the equipment is critical. Taking it off, even more so. Now, we've already shown you Tier 1 and Tier 2, and now we're going to discuss Tier 3. When is the time to don your Tier 3 level of personal protective equipment? In years past, there's been things like H1N1, SARS, avian flu, and we're currently experiencing the Ebola virus. A few of the important things with Tier 3, information has been gathered that you're dealing with a highly infectious disease that has the potential for life and death types of outcomes. So, time is always important, but not critical. Captain Valenzuela is going to demonstrate how to properly don your Tier 3 level. A few of the basics that we've seen with Tier 1 and Tier 2 and now Tier 3 are always protecting your eyes, your mouth, your nose. But as we saw in Tier 2, we're going to don your boot covers to begin with. Again, practice makes perfect, and this is something that oftentimes your hazardous materials technicians will have more experience when donning a specialized suit, and they might be the ones that end up going on the call itself when it comes to patient contact. A few of the things we already spoke about. Tight tops, and again, we don't want to trip on something as simple as a shoelace, so make sure that you're familiar with how to both put these on, make sure there's tight up top, and tie the laces to where you don't have an accidental fall. We want as few people exposed to the patient as possible. In most cases, we're going to have 2 technicians, and color is important here. Your technicians are going to be wearing yellow suits. For today's purposes, I'm narrating, but I would also be wearing a white suit, which is for the observer's role. And the observer, their whole point is basically to make sure that the technicians are protected from head to toe and there's no skin exposed. Going back to Tier 1, we're donning our our gloves. We've got boots on. And now he'll actually get into the TICAM suit. Now this crew generally has not had any exposure to the patient yet, so we're going to be free from any harmful effects. Pointing out, we always have overlap, and that's why it's important to put the boots on first. Boots are on first. We have an overlap when it comes to the pants. Now, again, overlap over the gloves. So that is a constant thing when it comes to the personal protective equipment. Got a zipper all the way up. And adhesive tape, so to speak, that will come over. Now we've got multiple barriers, multiple layers of protection to keep everything out of his torso area. Going back to Tier 1, glasses and mask. That's something that we've seen throughout Tier 1, Tier 2, Tier 3. Our levels of protection are built upon each other. Everything fits properly, glasses are not falling off, mask is snug underneath the chin, wrapped around the head appropriately. So, from head to toe, we're basically covered, and now our third step is actually going to be our respirator.
I'm going to need your help on this one, Barrett.
Okay, will do.
Just hold that for me and place it right in the middle of my back.
Okay, holding and placing in the middle of the back. Now I'm going to pull up on this a little bit just in case that he has to sit down. We want to give him a little bit of room. And that's something, again, if your hazardous materials technicians are familiar with the equipment, then they're going to know a few of the little tricks when it comes to both comfort and how to work in them appropriately, efficiently. And safety is the name of the game in this. This is when you're dealing with something that is just deadly. Hood is next. Okay. And last.
Now, if you would, just turn it on for me and plug it in.
We've got a yellow switch here. We're going to power on. We've got a hose that's going to connect into the top, and it's a simple screw on. Hand tighten, we're good there.
I'll take the hood.
He's going to have the hood. Now you can see, again, it's important that we're obviously quick because we're still dealing with a sick patient. But first and foremost, the most important thing, that he has every ounce of skin covered up and nothing exposed. The last step to that, again, we're always talking about layers and overlapping layers of protection. So we're going to tear off a little piece of tape. Secure this. And there.
Would you do me a favor and just check the back of my hood for me?
Going to check the back of the hood. Down all the way. Okay.
Good. Now take a look. Make sure I'm all covered up. And I have one more thing to do.
Okay. We know, time and again, the last thing we're going to do, double glove. Keep it in mind, we've got multiple layers on. Realize that your gloves might have to be a little bit bigger because now we're dealing with several layers. Again, the job of the observer, I'm looking from head to toe. I want to make sure that nothing is exposed, that we're overlapping throughout. And even this last critical step, overlapping gloves, because we've already discussed donning is important, doffing is just as important. How do you feel in there, Captain?
I feel good.
Okay, you look good. You're protected.
Now, if you would, check me over one more time.
One last time. Going to start up top. He's snug here. He's tight here. We've got overlapping areas when it comes to what's going to be handling the patient. His respirator, I can hear it. It's working on his end. We're all the way down to the boots. We've overlapped. Your hose is nice and tight so we don't have any accident with that coming off. And he has enough movement that he's able to still do his job effectively and safely. Tier 3, the most serious. We're dealing with life and death situations, very, very infectious diseases. Time is important, safety is critical. Now, part of a Tier 3 response has to do with getting the patient from their home to the hospital and the steps in between. So today, Captain Galad is going to talk about containment and transport of a patient.
So part of the support team is to prepare things for the crew that are inside at bedside or taking care of the patient. And one of the things that we can do in advance is to prepare the gurney for patient transport. We set it up with several layers on it. The first layer would be the mega mover with handles that we can move the patient. And the next two levels are going to be for containment as well as movement for the patient.
Now, your patient care team is on scene and getting the patient from the bed to the gurney. Now they're going to demonstrate how we do that effectively. We're going to use a technique that we use on a lot of medical calls, which is utilizing the log roll. In doing so, we move the patient on one side and then stuff as much of our material underneath that patient. We then move the patient back to the other side and unroll what was underneath that patient, trying to center them. Now, communication can be a little bit of a challenge here given the equipment that we're wearing, and we don't want to get ourselves hurt doing that lift. So we're going to coordinate with each other, make sure we go on a count of 3 and lift them back to the gurney. Once the patient is on the gurney, again, we're trying to minimize any fluids leaking out, and by wrapping that patient up with multiple layers, then we can do that. Now, we are going to leave the arms out in between the 2 blankets. That way, if there's any medical interventions that need to take place via IV or blood pressure, we can do that. Again, trying to minimize any fluids getting out, wrapping that patient up. They're going to use that 3rd blanket, and that blanket is going to cover up everything that they've done to this point in time. We don't want the patient to fall off the gurney. You have 3 straps. That last blanket goes underneath the 3 straps. Again, tucking, containing. And your patient is transported safely, everything is contained, and they're safe as well. Now, our number 1 job is protecting ourselves, and a critical step in that protection is doffing your equipment appropriately. Captain Galata is going to walk us through it. Now, he's going to give him directions. He's going to do a circle, looking for any gross contaminants that are on him, inspecting him from head to toe. At that point, he's going to hand him the disinfectant wipes. Very important that we thoroughly cleanse every part of the body that has been in touch with that patient, paying especial attention to those areas where 2 things are coming together, like the glove and the sleeves, the hood and the torso. Once he's done with those disinfectant wipes, he's immediately putting those into the proper trash receptacle. Now, time is not an issue here, thoroughness is. Take your time, get everything off of yourself, and again, head to toe decontamination is the most important step here. Once we've done the gross decontamination, now he will be sprayed with the disinfectant. Time, minimum of 2 minutes after he's covered with the disinfectant that we're going to let that stay on there. Again, getting all areas that have been contaminated, especially close attention to the areas where 2 things come together. Now, once we've let the contaminated areas of the suit sit for 2 minutes, we're going to use the same disinfectant wipes, and we're going to remove any of the liquid that we see. Now the observer is going to instruct him to basically do a 360, make sure that all the gross contaminants are off of him. We've wiped everything down thoroughly, we've sprayed everything, and we've wiped again. Now we're going to the gloves and removing the outer glove. Again, he's taking it in one hand, taking the dirty glove, putting it in the other, wrapping it up. Any of the gross material that is inside there is now hopefully contained inside the gloves. Now the observer handing him more disinfectant wipes. Again, you can never use too many of those. We're trying to get all of the contaminants off.
Ready?
Yep. Now, the observer is going to be turning off the papper and disconnecting the hood. He's going to remove the PAPR belt, and that is going to be set in the red trash bag along with everything else that has been contaminated. At that point, he's going to take the hood. It was taped in the front. He's just going to peel that tape away, take that over his head, and all of this is again put in the proper trash receptacle. Now, that's an important step. When you do that, try not to dislodge your safety glasses or your mask. A common theme that we're seeing, we're back to the disinfecting of the hands. You can't disinfect your hands enough because everything that you've touched has the potential that has been contaminated. Now he's going to get any of the suit areas. Seams are very important, so he's going to pay a special attention to the seams. There's a very good chance that the lower area of the legs, when it comes to the boots, are going to be contaminated. Okay, he's being instructed to turn around. At this case, the partner is wiping down the back area. He's got a pair of scissors in his hand. Making a cut in the actual suit itself, starting at the lower back and coming up. Okay, he's made a large incision in the back of the suit. Now, touching only the inside of the suit, what he's going to do is roll the suit into itself and down towards his feet. And a special attention there, obviously he's not wanting to touch any of the exposed skin. Again, decon the hands as much as possible. Take as much time as necessary. As we've seen with all other levels, we're trying to roll the suit onto itself and keep any of the contaminants inside. Now he can actually sit down in the chair behind him. Once he gets that suit down, notice how he's rolling it, rolling it, rolling it. He's going to pull the suit off of the legs, and he's actually putting it in the bag that was set up beforehand. So much of what we do, you get it prepped beforehand. That way you're not reaching and you're not exposing yourself to something after the doffing procedures have taken place. Another disinfecting of the hands. Those boots have been compromised, the boot protectors. So we will leave those in the bag along with everything else that's been compromised. Same technique, repetitive procedures that we're rolling and keeping the contaminants inside. Now notice that step. That boot is now protected. He stepped out of the bag rather than leaving it in the bag or stepping into something that is contaminated. Now, using another set of disinfectant wipes, one last cleanse of the hands. Last thing, same glove technique that we've used. You take off the dirty glove into the other, immediately followed up with an antiseptic hand wash. That's going to be something that we leave on our hands for 1 minute in its entirety. Now, at this point, you should not be contaminated. Never went back into the contaminated bag, throwing everything away in there. He's stepping all the way out and over, and now he can go to the station and shower using hot water and washing your clothes in the station washing machine. Now, the danger to that call is not complete because we still have some contaminated material here. So your support team member is going to come in now and show us how to actually take all of the contaminants and dispose of them properly. First, spraying the chair that was sitting in, that our team member was sitting in with the disinfectant spray, taking that out of the bag, and again, anything that was touching anything contaminated, we're going to spray. That's going to sit on there for a minimum of 2 minutes. Once the 2 minutes have elapsed, fast forward, going to continue to wipe down all of those aspects of the chair that had any potential for contamination. Anything that was contaminated goes back in the bag. Now, when we basically put this bag down at the beginning, you're going to wrap it or unroll it to where now he can actually keep all the contaminants in by just rolling it over onto itself. Notice he never came in contact with the inside of the bag whatsoever. The inside of the bag is where the bad stuff is. We're staying on the outside. Same principles apply there. We're never wanting to touch the inside of the bag because that's where bad things are at. Twisting, wrapping, make sure that there's nothing that is going to be able to get out of that biohazard bag. Wrapping it up, putting a knot in it, making sure nothing can escape. All of the material that was used, including the PAPA respirator, that is contaminated. Again, keeping it in the red biohazard bag, not touching the outside, putting a knot, and now you've basically taken all of the contaminated material, put it together, and even the support staff is always going to use the disinfectant wipes afterwards just as a precaution. And again, place in the bag. All of our contaminants are there. The key to effective decontamination is attention to detail. Preparation beforehand and then acting slowly and methodically. By doing that, you'll go home safe. Now, transporting the patient to the hospital is the last step, but it's so important that we take the same preparations and do that safely. How do we do that? Again, we've talked so many times about protecting ourselves with barriers. We're going to do the same thing to the medic truck. Now, the entire medic truck from head to toe is going to be covered. It's the same type of material that we used, absorbent on one side, impervious on the other side. What we've done is we've left half the medic truck exposed at this point and half of it is completely covered. So what we want to do is go from top to bottom when it comes to outfitting the medic truck. You've placed one blanket on the side. Our second blanket is going to start at the top. It's going to come over and we're going to tape any of the seams, making sure that it's from the top to the bottom. That way you have no material that can get inside the two. When we come to the next level, we're going to put the blanket underneath here. We're going to use a good seam, and again, top to bottom. That way anything that comes onto the walls is going to flow down and be contained at the bottom. Again, back, front, side, side, bottom. It all has to be covered just like our team that was having patient contact was covered from head to toe. The ambulance has to be covered from top to bottom. It's still a medical vehicle. It's going to be used again in the future, so we have to make sure that we keep it as clean as possible. Now, that patient still could require some medical attention as well. So we want to limit the amount of exposure the equipment that we are using has to that patient. Your EKG, if you do something as simple as wrapping that monitor in a plastic bag and just leave the leads out. Now the leads are the only thing that are exposed to that patient. That's something that's disposable and we can take care of. Now the medic truck is not something the chief is going to let you dispose of. It's going to have to be used again. So containment is key. Prep, slow, and methodical. Safety starts with us, the first responders from police, fire, and emergency services. And that means we're protecting ourselves every call of every shift. So please, take the information that we've learned today and commit to safety.